I'm going to have to use my outside voice.
That's really good.
Doesn't that work well? So Dr. Tyler Sanslow is currently practicing dentistry at Fenway Health, which is a community health center in the Boston area. That position, Dr. Sanslow practiced dentistry with the Indian Health Service and also internationally in Ecuador. So he has a very varied career in dental practice and has a perspective on global public health and also public health in the U.S. He works extensively with services, including dental services. And his presentation today is titled LGBTQ plus community, achieving dental health equity. So with that, please welcome Dr. Tyler Sanslow.
Look good?
Yeah.
Super. Cool.
Oh, yeah.
Afternoon, everyone. Thank you for the warm introduction.
Thank you for being here.
You bet. Good afternoon, everyone. My name is Dr. Tyler Sanslow. Most people just call me Dr. Tyler, so I go by for most of my patients and everyone else, so Dr. Tyler's fine. Dental care for the LGBTQIA plus population. I think in the book it had just LGBTQ plus. We seem to keep adding letters and to be more inclusive. So I reflected that in this. I was originally asked to give this by my dental director because she got asked. She usually gives this talk to the different dental schools in the Boston area. We're fortunate in Boston to have 3. She just gave birth to her 3rd child, so she said, I think I have someone who would be great for this, and asked me to come in her place. So thank you for having me, I appreciate it. And thank you, Annalise, for coordinating all of this, going back and forth. It was great. And thank you to the AIDPH Foundation, too. So thank you. I'm originally from Kentucky, and I have wound up in Massachusetts and have gone through a different variety of settings on my dental journey. I did my undergrad in Kentucky and then worked at a pediatric dental practice. And so knew I wanted to be involved with dentistry. But Spanish was one of my majors and wanted to expand upon that, really develop that. So I went to Spain and taught English for a few years and then came back and taught Spanish before attending the University of Kentucky College of Dentistry. Dr. Cafelli mentioned the Indian Health Service. For my externship, senior year of dental school, went to Minnesota and worked at Indian Health Service site there. And so from working with rural populations in Minnesota to Appalachia, which was mentioned earlier, even Yakima was mentioned. I actually interviewed at the Yakima Community Health Center and got an offer there, but ended up on the East Coast. I started out in Western Mass in Holyoke. There's a large Puerto Rican population there, and so whenever I finished dental school in 2017, I started in Holyoke in Western Mass in the fall. A lot of Hurricane Maria patients came, and so with my Spanish, I've been able to integrate that into my dental career. And so from rural populations and Indian Health Service sites in Minnesota to Kentucky to Massachusetts, and now to a more urban setting in Boston is how I've come to interact with the LGBTQI plus community. And it's been refreshing because it's as a member myself of the community, being able to identify with my patients and then really learn about the health needs and how we interact with the community. And for the LGBTQI plus population, it's not so much that their health needs are that much different from the general population, it's how we approach care for the LGBTQI plus community. And if I mess up on any of the pronunciation, I apologize. It's getting used to it still. So for today, we'd like to just learning the terminology. What's the language you use with patients? Lesbian, gay, trans. You'll see things like gender nonconforming, non-binary. What do all these terms mean? What's the right language to use? And so being aware and cognizant as providers will create a much more welcoming space for the LGBTQIA plus population. So for a while, LGBTQIA plus rights have been the elephant in the room. And so 2019, Merriam-Webster named they as their word of the year. And it's in reference to those who are non-binary. Binary meaning typically male or female is how you have gender. On your filling out a form, and it is, do you identify as male or female? Not everyone fits into those nice boxes. We like to put everyone into categories, sort of how we did with organization, putting things into categories. It's a way to help make sense of things, but it can also be limiting. And so being inclusive for the populations who struggle with healthcare to begin with, adding this extra barrier of them having to deal with insurance and, oh, my name doesn't match my birth name doesn't match what is my name now, and my gender has changed, and, getting insurance and forms, and that can all be another barrier to care for this community. So learning the language is something that's really important. So I'm going to go through a whole list here of different terms that we use. I'm going to go ahead and load them all up. And so for the longest time, it was, oh, it's down here too. For the longest time, we had just referred to, it had just been G, the gay community, and that sort of had been an umbrella term for anyone of the LGBTQIA plus community. And it's still, I would consider gay is still an umbrella term, one that's universal, but we've gotten more specific. So specifically, gay usually refers to males who like males. Conversely, lesbian for the same for women. Then you have all these other, there's bisexual, transgender, queer. The Q typically has a few different meanings. Queer, questioning, genderqueer. It's those who don't necessarily fit into that binary of male or female. Let's see, intersex. There's A for asexual. It's also known as an ally, is another term that's used for. An ally would be someone who is a supporter of the community, or an ally, a friend. And then we get some more or less commonly used ones, like pansexual, gender fluid, gender neutral, and some of these refer to gender identity or their sexuality. I'm going to get into that in a minute. And then the last, the term that seems to be the most inclusive now, the LGBTQIA plus, the plus sign is attached on there to not leave anyone out, to say it's more than just these letters that we have here. Perhaps there's some that we're missing. And so now some of the terms. So sexual orientation, gender, and gender identity, and gender expression. I'm actually going to go forward to the gender, this one here. I don't know if anyone has seen the genderbread person before. It's sort of a visual to help try to make some sense of it. And I'll preface this, even myself, I sometimes misspeak. I interact with patients every day. I'm even part of the community myself, and there's still times where I mess up myself. So it's okay. You don't have to be perfect. It's an ever-evolving process. And anytime you have a question, you can submit into Slido, and I'll be glad to stop, and I'll take questions at the end. As a teacher, I would often get questions from students, and sometimes I didn't know the answer. And it's okay if we don't know, but I would say, I will find out for you. So saying I don't know, let me get back to you. Making mistakes is okay, but then trying to learn from those and learn more is ideal. So gender identity, that's male, female, or non-binary, or any, what you were born with. Typically your sex is what you were born with, basically your physical parts. If you have a penis, male, the female parts, typically you're going to identify as female, but sometimes your mind or what your identity is may not match with what physical parts you have. So inside your head, you might be thinking, I identify as female, I prefer typically more feminine things. And those are constructs that we've made as a society of what's expected of a boy or what's expected of a girl or what toys you're given, how you're raised in your family. And so a lot of times people are at conflict with what they have traditionally and what's expected of them, and then what their identity is. And then adding to this is, how do they express that gender? So they have the sex, maybe they have a penis, so you would think, oh, they're male, but then they are female in their minds, but then how are they outwardly acting? So that identity, that's sort of an internal, think of it as internal, and then the expression is, what's that as expression, what's the external presentation to your community? And then add in another variable of attraction. So you already have this maybe complicated mix of going on, of happening, and then what are you attracted to? So there's multiple variables at play, and so I don't even know if the LGBTQIA plus terminology and the language and how we're discussing it now, I imagine we still have room to go. I'm going to go back to the previous one. So this emphasizes a little bit too, but I like the other slide a little bit better because it makes a nice visual and helps understand. And transgender, that's one that is often trans meaning different. So back on the previous page, there was cis meaning same, trans meaning different. And so oftentimes you'll hear it's a change of gender. And there's all sorts of different terms that have come about with this, from transgender, trans woman, male to female, meaning they start out as a male and then you transition to a female. Or if you're a transgender man, you are starting out as a female and you've transitioned to a man. And sometimes patients will write, FTM or MTF. And honestly, before I started working at Fenway, I was unfamiliar with a lot of this language too. And at Fenway, we have training usually about once a year to be able to keep up to date with a lot of the language that's being used. And at Fenway, I'll get into their history a little bit. I think that's coming up. I'll come back to that. So Fenway, the mission of the clinic is to serve the LGBTQI plus population and surrounding community in neighborhoods, creating a space where everyone feels welcome. And the clinic was founded in 1971, and so this is the 49th year. And it's expanded from what started out as medical service, mainly helping with the HIV, in the HIV population, and now has medical, dental, behavioral, optical. We have over 600 employees. About half identify as LGBTQIA+, and there's even a research institute called the Fenway Institute, and they wrote the first textbook on the treatment of the LGBTQIA+ population. And so we offer a range of services to be able to, we accept there's people of all backgrounds, but this really is a mission of the clinic, creating a space for this underserved community. And this is from the Healthy People 2020, the importance of treating this community. If we can improve the healthcare access for this community, reduce disease transmission, their overall well-being, and be better contributing members to society. I've adapted this, my director, she's the one who actually put the slide together, and I've added bits and parts and edited some. Should actually be a 49-year history. And these are some of our statistics. They're roughly the same for the 2019 year. In our dental department, we have 9 dentists, we have 8 hygienists, and we have 18 chairs, and have roughly 6,000 dental patients, and 30,000 patients at the clinic, about 6,000 dental. And then the top, those are visits, roughly the same for 2019. And like with the staff statistics, about half identify as LGBTQIA+. And this is such a relevant topic, and why we're discussing it here today, because we're finding that more and more people are part of this community and are finding it more safe to come out. The LGBTQ evolution is in the 60s, whenever all the social revolutions were going about, that's whenever this really came to head. If anyone's seen the movie Milk, that also highlights some of the social change that was going on. Then the AIDS epidemic through the 80s. And then in the 90s and 2000s, it's become much more commonplace with different celebrities coming out and making it more common for people to come out and feel comfortable. And that gets to a whole nother larger issue of the whole process of coming out and whether you have to and whether that's, whenever you're straight, you're not, hi, my name is so-and-so, I'm straight. It's identifying with this community, often you get grouped as, oh, he's the gay guy in class, or that's the lesbian, or so it oftentimes that's something, hopefully with conferences like this and having discussions like this, we can improve that so it's not such a process of having to come out. Cue the first Slido question. Perfect. So if you'll get out your phones, the first Slido question. I want you to submit which state you think has the highest population of those identifying as LGBTQIA+. So we do have limited data on the LGBTQIA+ population, and even with the 2020 census, there will be no question specifically asking what sexuality you identify as. So as a whole, we're not the best at knowing about having data on this population. And even so, even if there were those questions out there, a lot of times people feel that they cannot admit or answer those questions for fear of discrimination. So there is limited data, but based on the studies and data that we have, if you had to guess which states would have the largest population? Alabama, Massachusetts, California, chaos. 44, so California seems to be a popular answer. Texas. I've still not seen the right one yet. Massachusetts is number 2, so you're close. It's a New England state. You can go back to the slides if you want. So it's actually Vermont has a high, Dr. Kim, did you know that?
What? I did not know, but when you said your name, then I figured.
Vermont, no. Easy access. So Vermont, based on the information that we have, Massachusetts, Oregon, Hawaii, California, round out the top. So, but point is, people that identify as LGBTQIA+ are in all parts of the country, in all of our neighborhoods. Sometimes people are more open about it than others, And then, so that can make it hard, but hopefully by having these discussions, we can make it more comfortable so that people are able to openly identify as who they really are. It also shows the importance of why this topic is so important for all of us who are here from different parts of the states. I'm from Kentucky, where it's different. It's a lot different from, say, Massachusetts, where I'm at now. I'm from central Kentucky, and the cities in Kentucky are actually relatively open to the LGBTQIA plus community. There's healthy populations. Once you start getting outside into the more rural communities, that's where you find a little bit more of the discrimination and closed-mindedness, or it's just not as open of a place for this community. But point is, all across the states and the world, we have people from this population. Some are more out than others, but having more inclusive language, being more knowledgeable as providers can make it more, can create, lessen those disparities and increase equity for this population. I'm going to go through some statistics now that are in reference, they're mainly in the Massachusetts and Boston area, but can be translated to most places across the states. A lot of the racial makeup of the LGBT, or racial and ethnic makeup of the LGBTQ population is white. And let's see. This is showing the increase in population. It breaks it down with males and females. This is showing more females in later years. And let me go back to this. Dr. Griffith's discussion earlier about race and how all these different characteristics that we had listed up in the room, different activities. If you're a white male and gay and part of this community, typically that's been the most, it's now the most accepted or easiest, or people have the easiest time. And perhaps that's because it's just the social norms that have developed, but it's, as a white male who identifies as gay myself, it's arguably a lot easier for me than it is, say, a person of color who is from a different class or is female. A lot of times male and white has allowed you to have a little more privilege, a little more access to things than some of these other populations. And a lot of these statistics I'm going to show you are reflective of that. Transition or affirmation. This is more about terminology. So the transition or affirmation, there have been negative terms used like transvestite or tranny, some of these words that now are considered derogatory. So transgender is typically the most politically correct or neutral term to use. And the process that they usually, of undergoing the transition from a male to a female or vice versa, it's known as transition, or affirmation is a more newly used term because it's affirming what you identify with and what you were born with. And as part of the process, it's not only just the therapy side, the sort of social services, behavioral, but also the physical, like surgery needed to change parts, or to, hormones also play a part of this as well. So your hormone therapy, estrogen or testosterone, and all these services are available at Fenway Health. And our medical is our #1 department, but our behavioral health is our second most popular department within the clinic. And it's mainly for these patients. In 2019, we had roughly 4,000 transgender patients. And Fenway is one of the handful of community health centers in the nation that has the mission of the LGBT population. And community health centers got their start in the Boston area. It was in Dorchester, which is just south of Boston, that had the first community health center. It was part of the all the social legislation, and Ted Kennedy was involved with getting the community health centers developed, and they've since spread. Instead of transition, well, transition is still used, but gender affirmation or gender confirmation are common terms that are used. So now that we sort of have a language to be able to talk about this, why is it important? How is this influencing their health, and what can we do about it? That went quickly. These are some statistics from the Healthy 2020. People of the LGBTQIA plus population, they have a lot of emotional and social problems, more likely to attempt suicide, more likely to be homeless. Whenever people from this population come out, and a lot of times they are met with resistance from their families or their communities. They are kicked out of their houses, their homes, they're shunned by their friends. And so when they have all these other things going on, just trying to be who they are, trying to worry about getting health care, it often gets put to the wayside. And so that's a large reason of why we need to be more inclusive and reach out to this population and try to raise the equity, because they face discrimination just by being who they are. They are unable to have quality access to health care. At Fenway, we have there's the Borum Institute, and it's a department in the clinic that targets LGBTQIA plus youth and helps them transition back into society, find a place to live, find a stable job, get back on and being a contributing member to society. And these populations are also at risk for other health afflictions, STIs, HIV, AIDS, obesity. They just don't have the same access to care and things that most people do that are not part of this community. This is also from the Oral Health, or the Healthy People 2020. Social determinants of health that are targeted for the LGBTQIA plus community. They face with their legal documentation, and it can be problematic for whenever they're getting insurance. And if there's a hiccup with their name where maybe they've changed it, and that's not reflective on their driver's license or their social security or whatever documentation they have, they can often get denied insurance because they've changed their name, and that might not match other documentation that they have. And so if they don't have insurance, they're not able to get the health care they need. And so just creating a healthy and physical environment is important for this community so that we can increase their health equity. And so this is sort of tying together things that I've already discussed, from the external stressors of just their sexual orientation, their gender identity, their gender expression, and then how that influences how they interact at school. Maybe they've been bullied. Maybe by their friends they are not as well accepted. What's expected of them, what the injunctive norms are, and what expectations are there. And then all these affect how they behave. Perhaps they turn to drugs or alcohol because there's been no environment where they feel safe, and so they often go to these more, less healthy habits. The club scene for this community, or the party scene. It's been a space where they where they feel comfortable because they've been unwelcomed in other places. And sort of party scene is not the most healthy scene for this population and can lead to a lot of the health problems like the STIs, like alcohol dependence and other drugs. So, and then that leads to overall physical health and being able to contribute to society. Here's some more statistics. The youth are especially hard hit. It affects their overall mental health. A lot of them contemplate suicide, and there's been different, in pop culture, different TV shows such as Glee put a spotlight on this, if anyone's seen that show. More recently, the show Pose with Billy Porter. That's been, it highlights a lot of these issues. So seeing more characters and different focus in the media on this population, when it's presented in a positive light, shifts the message to discussing this and making it more commonplace, and hopefully addressing some of these different health disparities. It affects income. If you don't have access to the resources and are not able to be healthy, it's going to affect your ability to support yourself and the income that you have. Again, unemployment, food insecurity, unstable house. They might often be back and forth between different places to live because they've been kicked out by their parents or family or friends. And it's just, right now, it can be unstable for them. This is showing some use of the characteristics of youth and color, combined with being a part of the LGBTQIA plus population, and how they might not be accepted in their household. And within this community, so race, ethnicity, they might already be discriminated because of that, but then based on their sexual orientation, their gender expression, how they dress, how they express themselves, whether it be from what would seemingly be a guy, so you might expect them to have these masculine characteristics, but maybe he's wearing pink and he's painted his nails and he has longer hair, or he's wearing makeup, or females who dress a little more masculine, and that's their outward expression, and they're usually reflecting that because that's how they identify. Structural stigma. Let's see. So this starts getting into some of the things that we can do to create a more welcoming space for the LGBTQIA plus population. Oftentimes, like here, we have a women's bathroom and a men's bathroom. Perhaps you don't know which one you would use. There's been ongoing discussion in politics, North Carolina and other areas with having a third bathroom or a unisex bathroom, or and then with that, if you have to make a third bathroom for people of this population, well, then is that infrastructure? Are all businesses and places going to be able to make that happen? And so how do we adjust what we already have to accommodate the LGBTQIA plus community? At Fenway, we have all gender restrooms where there's no signage just for male or females. It's anyone can use any bathroom you want to. In most of our homes, there's not, you don't have a men's and a women's bathroom. You have a bathroom, it's down the hall. And so it's being more inclusive and supportive with our being more inclusive with our signage and how we create an environment that's welcoming for this population. We did not take out all the urinals from all the men's restrooms, so we do indicate that that is on there. We've recently updated the sign, so I believe these are the latest ones, but just letting people know that there is a urinal there to be able to have that choice. But it's, if you're a female, you can use that restroom too, or if you're non-binary, whichever you identify as. Health disparities. Getting more into the health disparities, more of the tobacco, drug, and alcohol use. This is just more statistics emphasizing what we've already been discussing. I have some situations coming up that I want to get to. So what can we do as healthcare providers to create a more welcoming space? So realizing that the health needs are not that much different for this population compared to others. They might have some different medications, such as Truvada or PrEP, drugs to treat HIV, testosterone, estrogen for their hormone therapy. And that's I don't think I have a specific slide, but Truvada or PrEP, it's a medicine to prevent HIV. So if you have a patient who is taking Truvada, it's a preventive medicine. It's not curing, it's not medicine that you would use to treat HIV. Incorporating different policies into whatever clinic you're at, organization, that are reflective of the LGBTQIA plus population, to create an affirming and inclusive environment. And not only for how you treat the patients, but how you treat other staff members, so your colleagues that you work with. So patient and employee non-discrimination policies, which include sexual orientation, gender identity, and gender expression. So there should be So on our health history forms at Fenway, we ask what their preferred pronouns are. So oftentimes whenever I introduce myself to my patients, hi, my name is Dr. Tyler. My pronouns are he, him, his. And so it's important to know these. And a lot of times they can often be a confusing one because we typically think of they as plural, meaning more than one person. Like that group over there, it's that group, they are going to, so it's often plural in the sense that there's more than one person. In the term of the LGBTQIA plus population, it's they because there's more than just one gender that they refer to themselves as. It might be male or female, but oftentimes it's more than just one, so it's they, because they might have characteristics that are both male and female, and they can't just fit into one box. So this is one way in your, whatever setting you're in, to be able to be more inclusive and welcoming for the LGBTQIA plus population, is physically putting a question on your forms. And then whenever you meet them, maybe they've left that blank. I would do my introduction. Hi, so-and-so, what pronouns do you prefer? What would you like to be called? And oftentimes, maybe I'll go in and the hygienist has cleaned patient X's teeth, and she'll be like, oh, she's waiting, and she might look like a female, but on her form she's indicated they, and so, oh, just be aware, it's they. So, it's not scolding, oh, it's they. You don't have to, just a gentle reminder that, oh, they prefer these pronouns. Or else she'll be like, oh, she's in there. I'm like, oh, they are waiting in there. And it's sort of weird at first, like it's just one person. You say, oh, they are waiting. So you might think, oh, there's a group of people. So, I mean, even myself, like it's hard to get into that habit, but it's, I've been at Fenway about 1.5 years now, and it's becoming much more natural now. And it starts with actually putting it on your forms and using it in daily practice. And also avoiding specific terms such as husband and wife, mother and father, which are distinctly masculine or feminine terms. You can do more gender-neutral terms such as relationships, or who's your partner? Are you in a relationship? Not, oh, who's your boyfriend? Like, if you see a girl, oh, who's your boyfriend? You You can't just assume, so we have to be careful about our assumptions. And so parents would be like for mother and father. Because some people might have 2 mommies or 2 daddies or 3 mommies. It's now 2020, so just being much more inclusive and not having these assumptions about what has historically been. We also have some questions at the bottom. What is your gender? Female, male, genderqueer, and or not exclusively. So trying to have an all-encompassing term. I don't necessarily agree with number 12. It says male or female, but typically when people are born, the doctors will just classify based on whatever parts they are, male or female. And do you identify as those, transgender or transsexual. And by gender, what is your gender? That would be your outward expression. Your identity and how you would outwardly choose to express it. And that may contradict from what you were assigned at birth. And you may be in the process. Some people are in the process. They overall look female, but they still have male parts. They've yet to undergo the actual transition surgery. So a big idea is just not assuming and expecting that everyone's going to be as they might outwardly appear, or as you would expect. And sometimes even if you're you might even be trying, and they still might get upset, and that's okay. Most people are not even aware, a lot of people are not even aware of all these other terms and terminology, so the fact that you're even trying, I would say applaud yourself for that. If you do make a mistake, of course apologize and try to be as understanding as you can. But I would not personalize it or be offended. You're learning, and it's not easy. It's not, you can just switch it on and learn overnight. So apologizing, try to convey the message that it comes from a well-intentioned place is important. Avoiding assumptions, I mentioned that. Same, they might appear as a male that you would expect. Instead of putting sir or ma'am or miss, just eliminating that. Try to, oftentimes, I'm from Kentucky, so it's like miss or sir, those are always, growing up, those are signs of respect. And then now it's trying to drop that, so reversing some of our habits that we've been into, what you might think is being polite and respectful, realizing that with this population, it's a little bit different, and we have to be more cognizant of that. He's here for his appointment. The patient is here, or just calling him by their preferred pronoun or preferred name. Do you have a wife? Are you in a relationship? Do you have a boyfriend? Do you have a girlfriend? No. Do you have a partner? Are you dating someone? Keeping it very gender neutral. Same thing for parents. What is your guardian's name? What is your parent's name? Caregiver. Here are some of the pronouns. Z, her, and hers are other gender neutral terms, pronouns that have been, that are used by some. The most common ones I see, of course, for people who do not use he or she are they, them, theirs. But some do use Z, her, and hers. All of us at Fenway, we have pins with our preferred pronouns. So it's on my lanyard. I wear it every day. And that's my outward symbol to know that I'm aware of the issues that are going on with this population and hopefully makes them feel more welcome. Obvious don'ts, don't be disrespectful, gossiping. And it's okay to have these discussions, but just be mindful of, maybe you have an open air clinic and you might think no one's overhearing, but just always being cognizant of the discussions you're having and who may or may not be listening. And so just always being aware of that. And so avoiding some of the outdated terms. So the list that I had in the beginning, those would be more accepted terms. So ones that have historically been used, homosexual, queer was often used as a derogatory one, but it's now had like a renaissance, and where now it's being preferred as a non-binary term. You might have heard, like growing up, people would always say like, oh, that's so gay, or they might say fag or faggot or queer. All these were used as derogatory terms, or tranny, transvestite. And so being aware of what words are socially acceptable and which ones aren't. And the cross-dresser transvestite, you might think like it's a male to female and they are physically dressed as a woman. You're like, oh my gosh, you're such a pretty woman. You look great as a woman. You might think that's a compliment. That can actually be really offensive. So like, you're really pretty for a woman. So just even that what you might think is a compliment, I caution you. So, you look, just keep it general. You look lovely. Oh, you look great. You don't have to put as a woman, as a man. Oh my gosh, wow. Like, of course, this is who they identify as and think they are. So just also being aware not only of the terms you use, but how you compliment or what you might say about their appearance. Putting what you learn into practice. So I have a few scenarios, and so we can use slide view for this. A woman walks into your office clinic giving the name of Lisa Doe. Her driver's license identifies her as Robert Doe, indicates male. There's some confusion amongst your staff about what the correct terms are and which name they should use. Which name should you? So if this happened, we'll cue the next Slido, but how would you address this? What are some things that you might be able to do? Preferred pronouns, ask for patients, go with how she identifies, training, meet with patient and ask about the preferred name pronouns, meet with staff to educate, smiles warmly, how would you like to be addressed? Fantastic. All these are great things you can do. Training, so asking them, being polite, asking their preferred pronouns, training for your staff. These are all great ways. We can go to the next question, or next scenario. Educate your staff. Y'all are already doing so well. Congratulations. You can go ahead and go to the next situation. Bless you. We have a transgender female patient named Julie Smith, walks into your office for a recall visit, expresses as female, but their medical records identify them as male, Joseph Smith. Dental hygienist calls the patient Joseph. Julie reluctantly gets up and is seated for her appointment, but corrects the hygienist, says, please call me Julie. You come in for the exam, and your hygienist again refers to Julie as Joseph using male pronouns during the whole visit. How would you address this with your hygienist, both in front of the patient and then after the patient has left the office? And so we'll do the Slido again. I know Slido typically works best for shorter answers, but we'll try it with this too. My director, she was the one who put most of this presentation together, and during this portion, she would have groups break up, and they would talk about these amongst themselves in groups and come up, more in group discussion. So I realize they're geared a little bit more for that, so we'll try our best to see. Apologize to the patient and then educate the staff. Educate them. Educate the staff. So this has oftentimes happened to me before, where I'll walk in and, she had her I'll be like, when did Julie have her last cleaning or last x-rays? And patient's still laying, it's Joseph. He had it then. I'll be like, well, and I'll try to really emphasize that in front while I'm with the patient. And then I'll like make some eye contact with the assistant or hygienist, and usually they're like, yes, of course, yes, I'm so sorry. And oftentimes they might say, oh my gosh, I'm so sorry, or we don't make a big deal of it. She now then just reflects it in her conversation, it's she. So typically, if your staff is well-trained and you have these policies in place, usually, if there's a mistake, usually someone on the team can catch each other and you can amend. And one of you might apologize, and sometimes I'll apologize to the patient if it warrants it. But definitely just, and then after the patient leaves, of course, emphasizing to be aware of pronouns that are used and just be careful of our language. And you never want to scold anyone or make anyone feel bad, because it's even myself, being a part of the community, working at a clinic, I still mess up sometimes. So it's okay, but just being aware of that and how can we be better going forward. Apologize, acknowledge the situation, have clinic or system updates. Yep. And that's something we do too. We have pop-ups in our dental health system that will they, them, theirs pronouns. If it's one that we might have messed up before, or one that might be a little bit confusing, like where it would be unexpected, we do have those pop-ups in there. And it's usually always for they, them, theirs. But if it's the he or she, typically it's a little more straightforward. It's the they, them, theirs that is typically a little more complicated. Document the staff behavior. It may get to that point where you have to document. It may get to that point. No one likes playing bad cop or policing, but because then it turns you oftentimes into the bad guy. But if you notice that it's becoming habitual behavior, maybe addressing it as a group, like, wow, I keep noticing that, so let's have a lunch and learn where we have this as the theme of it, and then you go through and you have a training for it. And that way you're not singling someone out on your staff, but you're addressing it, and hopefully that nips it in the butt. It doesn't always, but that's, singling someone out can be really disheartening for whoever it is, and like, oh my gosh, I messed up, and then that gets in, that leads to other issues. So addressing it overall and trying to keep it more general so that no one feels isolated on your team. We can go ahead to the next scenario. Male patient comes to your office for a new exam. You go over the medical history, lists taking Truvada as one of the medications. The assistant says, you didn't note that you were HIV positive on this medical intake form. Patient says, I'm not HIV positive. Medical assistant rolls her eyes, lets you know about this. How will you address this situation and with your assistant moving forward? So again, Truvada, that's PrEP. It's medication for prevention. It is not it's not for people who have HIV. It's a preventive measure that you take daily. And so a lot of my patients are on this. I've now seen on TV commercials, and you don't just have to be male or female. You can be any gender, non-binary. It's for anyone, male, female, non-binary, for the prevention of HIV+. So educate the staff, of course, on not only assuming and having that sort of attitude that the assistant did, but also what are common medications that you would expect amongst this population, Truvada or PrEP being one of them. Apologize to the patient. To the staff immediately. Apologize. Microaggression, that's a eye rolling or other, microaggression, passive aggressiveness, having zero tolerance for that in your office. And that's not a way. Not only does that create tension amongst the staff, but patients can sense that too. Go ahead, sir.
I have a question. All these scenarios have to do with the fact that somebody on the staff has access to information that the average person wouldn't have, like what medication they're taking.
Sure.
Or, you're reading a health history that says such and such. So, so that to me is really kind of the crux of the problem, is this disconnect. And then they're reacting in some, it's not quite the way the staff member expected, and so they're like judging, so don't judge. Like instead of saying, well, you must have HIV, say, excuse me, sir, I see you're taking Truvada, why are you taking that?
Sure.
I mean, that's just standard. I mean, who would say
So these are very extreme. These are like extreme cases, but trying to illustrate the point.
Yeah.
I completely agree with you. Most health professionals will probably not behave like this, but you might be surprised. I work in Boston, and it's a very typically in more urban centers. People are going to be aware of these issues. After I go back home to rural Kentucky, I imagine a lot of people have not heard of these medications, even though they might be on TV, and then we're thinking the general public knows about these. But I imagine a lot of people do not know about these. We go ahead to this one. Let's skip this one. We'll go to. We'll do this one as the last one, and then we'll end with questions. So a 5-year-old comes to your office, 2 female parents. And then the assistant starts asking some questions about home care and the parents. How would you address this, and what terminology is being used that you might change? So you can go ahead and do the slide for this one. So again, it's a kid with 2 female parents, and they're asking about mommies, and which just not being as inclusive with their language regarding the child's parents. Excellent answer. Avoid making assumptions about gender roles. Apologize, educate staff. I think that one's applicable in most situations for this. Educate staff, train. And granted, we're all at a conference addressing inequity, so we're already in the mindset of a lot of these issues. We can't make the assumptions that all other dentists, doctors, healthcare providers have the same background and training that all of us in this room have too. So we have a bit of a leg up, and it's a task us with the responsibility of trying to lessen these health disparities, have better approaches for the LGBTQIA plus population, and put some of the things that we've discussed today, like policies for your staff, how you regard the patients, each other, the forms that you have, the services. Do you have a department that helps people get signed up for insurance? And are they able to help them navigate? It's a difficult process getting signed up for insurance, and then compile some of the LGBTQIA plus issues with it. So do you have staff that is able to help patients get the insurance they need so that you can actually provide the care? Physical signage, on your bathrooms, pins for yourself. And we have pins. I should have brought some pins for you all here today too. They all say Fenway Health, but we have pins out or stickers that they can write their profile names. And so maybe, for the rest of the conference, if you meet someone new, whenever you say, hi, my name is so-and-so, you can also introduce yourself as the pronouns you prefer. So you can get a little practice here. And so we'll start with that. Any questions? I think they're going to get the microphone. Or if you got a loud voice, you can do that too.
Thanks so much for your presentation. I have two questions, actually.
Yeah.
One, you referenced that you all have an annual training. So I just was interested in, who does that training for your staff, and if there's some recommendations around that. The other question is, specific to dental. One of the things that I struggle with from working with the Ryan White B program in our state is assisting contract providers. So, this is kind of our first year having contract dental providers. We have a standalone clinic that we have part-time dentists. But we also, because of the increase in HIV in our state, are working to expand the providers who provide dental care. So one of the things that I'm looking to do is to provide a similar level of training based on some things I'm hearing in the field. For example, as we know, this population of patients may have more trauma. So they may have more dental anxiety. For a provider who's not taking that in consideration, then, they may be tossed away to say this, patient was irate because of that competency around this culture. So what recommendations would you, give as it relates to really putting something like that in place, whether that's, a training that they have to go through as a part of them being a provider?
Absolutely. It is someone from the Fenway Health Institute. That's the research branch of our clinic. We schedule lunch for all the providers, including our assistants. It is everyone on the staff. Not just dentists, hygienists, but the assistants, the back desk staff, so that everyone is on the same page. And someone from the Research Institute, which they do our grant writing, they do most of the training. If you can go to the slides, I have my contact information. Send me an email. I'll send you resources. Send me an email. If anyone would like resources about training or more resources, I would be glad to get you that information. Absolutely. Absolutely. And we have a lot of Ryan White patients too. So, and the coverage, dental coverage for those patients, it's pretty good. So if you can get that up and going, it's fantastic service to be able to decrease these health disparities for the population. But absolutely, send me an email and I'll get that to you the next week or two. Absolutely. Yes, ma'am.
Yeah, I have a few questions for you. So one that you talked about, the resources. Do you have anything specific that we can use with dental students? Or do you think we can use that training that you mentioned with the dental students as well?
I think a lot of the same training that we do with our providers is applicable to dental students. They're in dental school. They're our colleagues now. I consider them part of the community. They don't have their full license yet, but you get into dental school, that's a serious, you're essentially in the dental community. So I think the training that we do for the staff and who's actually working is translatable to dental students. And it should be part of the curriculum for dental schools, 100%.
Right. The other question I had about the forms, the inclusion language that you were discussing, do you translate that in Spanish? And
we do.
How does the translation work? Does it work well?
We have our forms in Spanish. I'll have to take a look and see, but as far as that's an excellent question.
Okay.
I will look into that.
And the last thing I wanted to say was not a question, but it was a comment.
Absolutely.
That all the scenarios you showed were the dentist correcting the staff. I think the reverse happens a lot more.
Absolutely.
I am pretty sure hygienists are correcting dentists a lot more than dentists correct. So you might want to tweak your scenarios for the next time.
Absolutely. And again, I'm welcome to any and any and all criticism. This is the first time I've given this presentation. It's usually my dental director, and I've adapted some of the slides. And those are all ones that she created. So excellent suggestion. I have already made a list of some things I wanted to change, and that will definitely be one of them. So better scenarios. Thank you.
Hi, thanks for your presentation.
Thank you.
First a comment and then the question, but the question is for someone who has knowledge or expertise, in current Texas law as it affects health policy. The comment is great information for folks who practice in Massachusetts, great information for healthcare settings in Massachusetts, and states like Massachusetts that actually have enacted laws specifically to protect individuals from gender minority communities. However, my understanding is that, let's say in a state like Texas, I don't know whether the Texas Religious Freedom Act is in place now or may come to fruition soon, but it would give that hygienist who specifically chose perhaps to use the
right to decline treatment for.
The name, never mind decline treatment of Lisa, the perfect right to do so, and probably would have put the employer and you, the doctor, at legal risk for denying that hygienist's right to deny care to a particular kind of patient or to use certain kinds of politically correct terminology in regards to their care. So Texas is not unique in this. If they haven't actually enacted that into law to make people able to do that, deny care because of gender orientation or identity, then I'm sure many, many other states in this nation do that. So any comments or observations?
And there's a case amongst, I believe it's going before the Supreme Court, and they're going to rule on it this coming summer involving the cake. I believe it was the cake that was being made for a couple. Anyway, I believe that this specific issue that you're bringing up is before the Supreme Court, and this summer, I believe, is when they're going to release their ruling on it. So TBD on the overall national health policy. At Fenway Health, we have patients come from all over New England and surrounding states because of the mission of the clinic. And so a lot of states like Texas, you're exactly right. They don't have the same open and inclusive environment and policies, like physical policies, to be able to treat this population. I completely agree with you. If I give this again, I will absolutely try to include more information and make it more applicable for the national scene, and again in your state too. So yes, that's 100% an issue, and I think we need more information on it. Scott, go ahead.
Yeah, I do appreciate the call out on the laws that affect each state and how, maybe a way of approaching that is also the way you design your clinic. So Fenway, for example, they make it a call out that it's part of their culture. And so if it's part of your culture to have that sort of inclusivity, it may also attract a certain type of workforce, but something to think about. My question actually has to do with restroom signage, because I appreciated that you had a sign on that, and it's another deep dive into one of your tips. And actually, we're working on changing bathroom signage at the American Dental Association to be more inclusive. And we actually had a discussion on this, because we were saying, do we want, I saw that one of the signs you had called out gender, so it says all gender restroom. And we had a discussion saying, well, is this kind of like when there were restrooms not too long ago that said all colors allowed or colored allowed? So by calling out gender, you even make it something that is, discriminating in a way. By saying, other signs can say accessible. I really like the one you had that had the different images, but that's kind of my question is there a certain reason right now that there is an ask for saying all gendered restroom versus not saying it at all? Is there an extra step? Because I know you also said it shows that you've thought about inclusivity, so that can be a plus. But would it be better to just say restroom or just say what sort of facilities are in there? Picture of a urinal, picture of a toilet, call it a day.
Or just say restroom.
Right.
Just restroom. Again, Fenway I think with the past few months, just replaced some signage, because there's, even within a forward-thinking clinic like Fenway, there's still this internal discussion about what's right, what's appropriate, what's the most inclusive, how do we approach this? So I think we're still evolving thought. That's an excellent suggestion, just restroom, bathroom.
Right. And then my second question has to do with the default they. So if you're not sure of someone's preferred pronoun and they haven't specified it yet and it's not on a form, is it better to ask, may I know your preferred pronouns, or is it better to go to the default they?
I would ask them. I would ask
Good
them.
to know.
I would introduce myself. Hi, my name is Dr. Tyler. I use he, him, his pronouns. How may I refer to you?
Great. Okay.
It's typically how I've not had backlash or negative feedback from that, and that's typically during our training how they recommend proceeding with it. So not assuming, but do yourself and then ask a general question.
Tyler, I don't know if this will go to you, but the gentleman that brought up the religious something law, does religion give you, this maybe gets too deep, but if you to say you're not going to call someone by their name, that I don't know if that's tied to religion. Like if I changed my last name maybe to my mom's maiden name or something, and my doctor wasn't calling me that, my reason for changing my name might have nothing to do with gender. So I'm kind of curious if we see that as like a significant problem, that if employees at my clinic aren't going to call patients by their name, they're an inappropriate employee at my clinic. I'm concerned that we couldn't address that issue, regardless of their reason for not calling the patient by their name, whatever their beliefs are. That's really concerning to me. And this may be just a general question, again, not applying to your clinic, which is going to call people by their chosen name. I don't know, just wanted to raise my concern for that. And if anyone knows related to the bills or the laws, how that works.
Your question, how does religion affect how the name being called?
Yeah, because I know with these bills you can,
Sorry.
I know with these laws you can choose not to treat someone or not to give a medication, but can you choose not to call someone by their preferred name? I just don't know if anyone knows how these laws work. Because that's really concerning to me if you can't call someone by their preferred name and you're going to be protected by a law.
To me, that seems like an extreme of it, just being able to call someone by their name. To me, it's more of a service. You can deny a service, or you can deny providing care based on your religious beliefs. I believe that's the case that's going before the Supreme Court now, because of their religious belief, they don't believe in homosexuality, so they denied making a cake for this couple. So that, to me, I don't know about names specifically. I need to look more into that then. Yeah.
Okay, so Dr. Sanslow, I believe that is the last question that we have time for, but this is a lively discussion that we are going to continue now in our activity session. So if you have more questions with Dr. Sanslow, is it okay if they contact you later and kind of workshop through this?
That's why I put my email and even my cell phone numbers up there. If you ever have questions, I'll be glad. And if you have criticism or ways to make this better, absolutely, I'm 100% open to criticism of any sort. I'll put that back up there. And thank you for being a patient audience and having me in here. I'm honored to be amongst such esteemed colleagues. So thank you. Absolutely.